We are Team BIOMARKSMEN, presenting the cross-platform application Alztracker. So the condition we are targeting is the disease Alzheimer's. It is an irreversible age-related disorder that is commonly associated with memory loss and impairs the ability to carry out daily activities over time. The worldwide projection of Alzheimer's prevalence shows an exponential growth over the last 15 years, and by 2050 is expected to reach 106 million worldwide. So what are the top 10 early signs of Alzheimer's? They include memory loss, changes in the mood, misplacing belongings, and over time can degenerate to total social withdrawal and confusion of time, place, and person. So the problems we diagnosed here is that it is often difficult for clinicians to know when mild cognitive impairment or MCI, a reversible predemential state, would progress to Alzheimer's disease. There is a need for an evidence-based patient-specific solution to arrest or delay the disease progression at the MCI stage, and there is also a need for long-term planning of the treatment for advanced cases. Hence, our objectives are the early and accurate diagnosis of mild cognitive impairment in AD or Alzheimer's disease, including early clinical interventions, which would hopefully reduce the cost of long-term care. We also hope to give the patients a greater interaction with their doctors and a better understanding of their condition and the effect it has on their lives. So our solution is Alztracker, which is like a one-track solution to all your problems Alzheimer's. It has two interfaces, a doctor's interface, which shows 4 different modalities of biomarkers for accurate diagnosis and treatment planning. This is followed by a patient's interface, which shows his diagnosis, the reports, management, as well as follow-up in single layman's terms for him to understand. So it is followed by the implementation overview, where we show the same information in 2 different forms for better understanding in the clinician and the patient's interfaces, and it is followed by a long-term treatment tracking process. Thus, how would the platform exactly work? So the patient goes to the doctor for consultancy after episodes of memory loss, following which he completes a couple of diagnostic tests as per the doctor's advice and logs on to the Alztracker with UID, using the interactive chat to discuss concerns with the clinician and finally tracking his progress via the platform. For the doctor, he analyzes the reports present on the platform and confirms the diagnosis, decides on clinical interventions, treatment plans, and interacts with the patient. A market overview has yielded competitor apps which use cognitive language and speech therapy for brain rehabilitation exercises and to reduce memory loss. But how we are different is the fact that we streamline the total diagnosis and treatment procedure, encourage clinical evidence-based decisions to arrest the disease progress at the MCI stage, and make the entire process very easy to access. Our future prospects and management plans include a short-term plan of full data integration of the patient, deploying a robust data analyzing system, and reaching out to clinicians and patients as well as their families, who form the largest part of our platform and what we are trying to work on here. Our long-term plans include improving the patient interface of the platform, user testing, and application for an NIH grant. Our go-to marketing strategy includes funding from the Under 24 NIH grant, implementation costs including web designing, network maintenance, and others that have been mentioned here. So that is the plan for Alztracker's cross-platform application, which helps to streamline the diagnosis and treatment procedures for Alzheimer's disease. This is the team which has worked on it, and we are extremely thankful to our mentor Maggie Emineza, as well as Joss Amros and Albert Shee for their wonderful presentations last day, as well as the MedHacks organizing team and our sponsor, the Johns Hopkins Applied Physics Laboratory, for giving us this wonderful opportunity. Thank you.